Hi, everyone. My name is Gabby Pendley, and I'm the Perinatal Mental Health Program Manager at Wildflower Center for Emotional Health. We are an outpatient psychotherapy practice based in Chicago and Oak Park and in Colorado, and we specialize in perinatal mental health and all things reproductive mental health. Today, I'm so lucky to be here with Marco Renzi, who is one of our clinicians, a perinatal mental health certified clinician, and one of our clinical supervisors. And I'm here to interview him about his unique experience as a male PMH-C, which stands for Perinatal Mental Health Certification. Hi, Marco.
Hi, Gabby. Thanks for having me.
Yeah, absolutely. I'm so excited to talk about this today. So I wanted to start off with asking you, as a male therapist, what inspired you to specialize in perinatal mental health?
The main reason I started at first was just my own lack of knowledge. It's something that I hadn't really taken any classes on in school. I hadn't had much training in, and it's a really big part of a lot of people's lives. A lot of people will go through their lives either knowing they want kids, knowing they don't want kids, or kind of unsure. And that's going to come up in therapy sessions. And I really do have like the core belief that as a therapist, it's our responsibility. If there's an area we don't know about that's so common, it's our obligation to learn. And like, as I was going through the PMH-C process, like it became more and more exciting. Of like, this life transition is such a big one. It's one of the biggest changes we will go through our entire lives. And it's really nice to be able to help clients through this period with like our own expertise versus just kind of having to fumble our way through it.
Yeah, absolutely. It's such a profound time. So what has your experience been like in starting to gain all this expertise and working with pregnant folks and their partners and birthing people?
Yeah, I think like the biggest surprise I had was Postpartum Support International, who is the organization that gives the PMH-C, really is very thoughtful about how they do their trainings. So I went through a multi-week training course, their maternal mental health course. And if you've ever been in like trainings, you know that like a lot of them are really boring. And what I really love like Postpartum Support Internationals is that they covered so much information in such a short period of time, ranging from medications with like perinatal, how it interacts during that period. What does mental health look like? What are the most common concerns perinatal people have during this period? Like male maternal health, there's a lot of stuff going on that I either didn't know was an issue that I needed to address or knew was an issue and didn't know how to address. So I really felt like what I learned was incredibly helpful, not just for the clients that I like were explicitly coming for perinatal, but clients who were debating about expanding their family in the future, clients who were struggling with infertility, clients who maybe were on their like second or third kid and were like, hey, why is this one so much harder? Or why is this one easier? What was hard with my original birth experience? And it really has allowed me to like better help people who feel really isolated during this process. And it's really helped me build a much better therapeutic alliance with my clients, frankly.
Yeah, it's so awesome that training really equipped you to work with all of those things.
Yeah.
So how has becoming certified in perinatal health enhanced your clinical practice and your work with your patients?
Yeah, I think like one of the biggest things is that like a lot of the times our society talks about this change as like the perinatal period being like one of the happiest times of our lives. And it can be, and it can also be one of the most stressful, draining, and isolating periods in our lives. So I think it's really important that like we have the insight and knowing of like how to deal and how to create an effective treatment team during this period. And I think like it's important so that we can give our clients like make this a joyful or a positive experience so they can really process and be present during this time. And I think without the training, I wouldn't have been able to do that. So I feel like this training lets me help clients, whereas before I may have had to refer them out, frankly. Like especially as like a male identified clinician, I will not go through these physical changes in the same way as a lot of these clients. So I better know what those changes are. I won't be able to experience them myself.
Yeah, absolutely. You need that expertise.
Yeah.
As a male identifying perinatal therapist, have you had patients who are reluctant to work with you because you're a man?
Yes. Frankly, that is absolutely a concern. Like, kind of as I just mentioned too, like, because I like will not physically be going through the changes or the hormonal changes or chemical changes that they are going through, sometimes they don't want to work with a man. Like, that's actually one of the big benefits of being a PMH-C is that they know I have gone through extensive training. I'm not just a standard male clinician. I have put in the work to know that I will be able to serve them. And at the same time, my role is to validate them. If they want someone with a different identity than me, that's okay. And on the other hand, there are also clients who are excited to work with someone male, especially I'm thinking of like new fathers during this process. Because of how rare male PMH-Cs are, a lot of times men don't have someone they can reach out to that they can trust, understands their experience. So I think it really allows me to see a population that is also kind of critically underserved.
Yeah, that makes so much sense. And how cool that you can be there for them. What would you say to someone who's experiencing mental health or relationship challenges during their transition to parenthood, but is feeling kind of reluctant to seek support?
Yeah, I think a really common theme I hear from my perinatal clients is they wish they had sought help earlier, frankly. But I've never had a client said, oh, this is too early for therapy. Every time someone comes in, if you're ever wondering, is therapy a good idea for me now? The answer is almost always yes. Your mind isn't going to say, do I need this support? Unless it's really considering that you might. That means you're struggling. It means you can get some support. Like, do you need therapy? Not necessarily, but why would you go through something alone and without support when you can have that support instead? And that's really what I think therapy can do, is allow you to make this process easier. Like, you can struggle through it and white knuckle through it if you need to. If you don't need to, why would you?
Yeah, that makes so much sense, having a lower threshold for seeking that help.
Mm-hmm.
So Marco, as someone who specializes in working with couples and in perinatal mental health, can you share a little bit about some of the common challenges you see in couples as they navigate the transition to parenthood?
Yeah, absolutely. I think during any life transition, it can be a really big strain on the relationship because a lot of times our identities shift. But I can't think of one that'll impact the relationship more than going through with family planning, whether that be fertility struggles, whether that be a difficult pregnancy, a difficult birth, or no fertility struggles, an easy pregnancy, an easy birth, and a really hard transition to being a parent. These are lots of life transitions crammed into a very short period of time. And with everything that's going on, a lot of times we have to focus on ourselves to kind of like get through this process as much as we can. And that can have a really big impact on the relationship. So I think a lot of the times people will report, and like research supports this, that the time right postpartum is a time of actual disconnection rather than enrichment in the relationship. So it's really important that we build up our toolbox and feel comfortable and knowledgeable how to address our relationship during this transition as well, because it's going to need support during this time as well. And if we don't, and it falls by the wayside, that's going to have like multi-year, or the entire like relationship might dissolve. Like, we don't want that level of impact. And this can be a time of strengthening the relationship, of increased closeness while expanding the family. It just takes more intentionality to do it.
Yeah, that makes so much sense. I have one final question for you. What advice would you give to any male therapists who are considering specializing in perinatal mental health?
So I'm biased because I did it, but it really does feel like a no-brainer to me. This certification, especially as a male clinician, is a really rare one for people to have. It shows, like any client's interested, that you are working with a population that male clinicians don't typically have a skill set to work with. It shows that you are willing to put in the work, and Postpartum Support International really does prepare you to work with a huge variety of problems. As you kind of mentioned earlier, that question, like, pre-PMH-C, I had a lot of clients who were not willing to work with me because I was a male therapist. Hearing that I've gotten trainings isn't the same thing as knowing that I'm certified and gone through an extensive training program to get to this point. This certification opens doors to help clients like who may be nervous about working with a male provider, who may be nervous about therapy in general. And this allows them to kind of trust that I have the competence and the skill set to help them during this time.
Yeah, that makes so much sense, and it's so valuable.
Yeah.
Marco, thank you so much for sharing more about your journey with us today.
Of course, thank you so much for having me.